and another great SDSI. And so my charge here is to go over the on-track, off-track paradigm, not so much talk about the pathomechanics of it, but really roll up our sleeves and get into how to calculate these things. And then we'll talk a little bit about when it matters. We're going to go through this in a stepwise way. We're going to talk about addressing the glenoid, the hill sacks, and then putting these all of these things together. But I want to avoid this situation. We're going to keep this as simple as we can. And so at the end of this, I'm going to ask you to remember 3 equations and 2 numbers. 3 equations and 2 numbers. What's that? Starting with what do we look at from an advanced imaging perspective, CT, MRI. There's plenty of studies suggesting that both CT and MRI can be helpful in making these determinations and helping us make these measurements. There's been several Delphi consensus type statements that have come out and have acknowledged 3D CT as the gold standard. I would submit to you, though, and I'm sure as a lot of you appreciate, there can be some logistical issues with respect to getting 3D CT scans. And I think in my practice, and we can certainly talk about this in the panel, MRI has become more of the standard first line modality for me. I think there's real concerns about radiation exposure. We can talk about whether or not MRI is good enough. The Utah group has looked at this and has compared MRI to CT scan. And I think you just have to be mindful of what the result of using those images modalities is going to be. If you're using a CT scan primarily, you're going to have more off-track lesions. You're going to tend to not overmeasure, but you're going to measure higher magnitudes of glenoid bone loss as opposed to the MRIs, which are going to be less reciprocally. So how do we assess the glenoid? How do we measure it? These 3 points I think are really important. We're going to